Now to an experimental trial of a vaccine against HIV, which has had to be discontinued by US health authorities. The trial, which is named HVTN702, began 4 years ago. It involved more than 5,000 participants in South Africa, but it proved to be ineffective against the disease. To find out why, we're joined by Dr. Carl Dieffenbach, who's the director of the Division of AIDS at the National Institute of Allergy and Infectious Diseases in the United States. Thank you so much. It was your division that sponsored this study. Explain to us why the need to stop it at this time. What was not happening with this?
So by stopping the study, an independent group outside of the trial took a look at the information that has been generated to date, and based on rules that were set before beginning the study, said this trial can never demonstrate any level of activity for this vaccine. So it's highly appropriate to stop the vaccinations and then start a year of follow-up just to make sure that everybody who received the vaccine is basically fine.
So how was the vaccine supposed to work then?
So the vaccine's supposed to go into your body like any other vaccine and make an antibody or an immune response that will then fight the virus. And while we know the vaccine went in and made an immune response, it clearly was not able to fight the virus.
So it's from the just over 5,000 people that took part in this. Nearly as many people became infected with HIV as didn't. Is that my understanding? So why did this fail?
Correct. That is the most important question. It's a very important question. But what we saw, and that's why we do randomized controlled trials where half the people get the vaccine and half the people don't. And if the infection level is the same in both groups, the vaccine's not working. So it fundamentally failed to do what it was designed to do.
But what is interesting is that this is based on a previous vaccine that a study that ended in 2009 in Thailand. That worked. So why is this one not working?
Well, that's a really interesting question, and it most likely, and this will be a lot of speculation, but my personal feeling is there's something unique about the virus in South Africa that's different than the virus that's circulating in Thailand. That said, that's just one idea. There were a number of changes that had to be made between the vaccine we used in Thailand and the vaccine we used in the Republic of South Africa, but that was required because of the differences in the virus. So we have a chicken and egg situation here, and we don't know if the chicken's at fault or the egg is at fault.
On that note, we're going to have to leave it there. We're out of time. Dr. Carl Dieffenbach, thanks so much for speaking to us here.
My pleasure.